video, I will be discussing the invitational skills, which are the basic listening skills that invite the client into the counseling session and to start to engage in and build the therapeutic relationship. This means that these are the very first skills that you will be using as you start to engage in the counseling process with a client. I find this quote particularly helpful to keep in mind as we begin to discuss the invitational skills. So Mark Young says, the therapeutic relationship can provide the opportunity to heal the body and the mind if the helper can get out of the way and allow the client to open up and investigate all the nooks and crannies of the problem. So keep this in mind as I begin to discuss the invitational skills and start to think about how you're going to balance the invitational skills with the skills we'll be learning later in the class in the next week, the reflective listening skills. Because it is very tempting to rely heavily on some of the invitational skills, but sometimes it's important for the counselor to get out of the way. So part of the reason that we believe that counseling is effective, as Young states in the textbook, that essentially listening and having a client share their story can have a powerful healing effect. In particular, the type of listening that we engage in the counseling process is referred to as active listening. It's a way of attending and encouraging without intruding on the client's telling of the story. And if you'll notice, I'm continually emphasizing that the counselor sometimes needs to get out of the way. I think sometimes in our best intentions, in our desire to be active counselors, we can sometimes get in the way of the telling of the story and then miss details that are being communicated. So what can distract a counselor from listening to a client's story? So the very thing that creates a strong therapeutic alliance and a good counselor, empathy, is one of the things that can actually get in the way of the counseling process. Counselors get into counseling because they want to help clients. And so sometimes the pain can be so powerful for an empathetic counselor that they want to make the pain go away for the client. But that is problematic. Sometimes clients really need to experience their pain, and for us to say that we can just solve their pain or make their pain go away at the moment is often seen as very dismissive. The other thing that can get in the way of listening to a client's story is personal anxiety. So performance anxiety about your performance within the counseling relationship, anxiety about what the client may be experiencing, also impatience about where the story is going. So this is where it's helpful to be very attentive and present in the moment and not be trying to rush ahead or think about where the story may be going. And then finally, preoccupation with premature interpretation. So if you are looking for the answer, if you are looking to provide answers to the client, this can frequently get in the way of listening to the client's actual story. So we tend to avoid offering advice within the profession of counseling and the type of listening that we do as counselors. And this is because quick advice can be dismissive of a client's pain. You may have experienced this with someone where you're trying to share a struggle with them or something that's really bothering them in your life, and they have a quick and easy solution that seems very obvious, and they're not listening to what's actually going on with you. So it's important for us to listen first. It also can disqualify the helper in the client's eyes. So if you are quick to offer advice that possibly does not fit the problem, or you don't really know the client, it can communicate that you're willing to tell someone what to do even when you don't know them very well. So overall, we avoid advice, particularly very early in the counseling relationship. You don't want to immediately just provide resources or referrals or interpretation of what you see is going on with the client. So within the counseling relationship, pretty much every theoretical orientation places the client as the expert. And so the client holds all the information that you need to help them. Your job as the counselor is to facilitate a process where the client can build awareness of that information, and then you, by virtue of the client having the information and sharing it with you, will then have the information to get a perspective on what's going on. It can be helpful, as I mentioned before, just for a client to share their story. Listening provides the information that we need to help a client to understand their world. So if we're going to be providing theoretically informed interventions, after you've taken a few more counseling classes and gotten some more training in different types of interventions, you really need to know what the client values, what's important to them, what type of culture or family that they grew up in order to appropriately provide any type of intervention. So the helper's role can appear passive. And I think this is what can frustrate beginning counselors, is you don't necessarily feel like you're doing very much. You're asking very open-ended questions, which I will get to in a moment. You are reflecting, which we will get to next week. And it seems like you're not doing much, but you are listening in order to understand. So often what keeps people from feeling understood or being understood and missing the key parts of information that they need for change is that no one is truly listening to understand. They're listening while waiting to talk, or they are listening in order to fix. Really early in the counseling relationship, particularly when you're beginning to engage in more invitational skills because you don't have information to work with, you should really try to avoid anything that's focusing on your interpretation for what might be going on. You're looking for emerging themes and patterns. Particularly early on, you might see interesting tidbits of information, but until you see that those things are happening consistently, you don't necessarily want to intervene on them. And so, as we'll discuss throughout the course, you really need to find a balance between the invitational skills and then the reflective listening skills, which will be paraphrased reflection of feeling and reflection of meaning. Finding an appropriate balance can really help to build two of the major counseling process tasks. So the very first task that you're attending to is building the relationship, building a safe, trusting relationship with the client where they feel like they're heard. And then assessment. So you're trying to figure out all the pieces of information that you can get to know to really know a client. Until you have a good sense of what's going on, what's important to the client, what's contributing to them, who they are as a person, what they're doing there, you shouldn't begin to engage in case conceptualization, goal setting, or treatment. So if you really do a good job of asking questions and reflecting on what the client is saying early in the counseling relationship, you will have a good foundation to then engage in goal setting and treatment or intervention. So the counselor's nonverbal expressions are important for communicating, listening, and empathy. Just like your verbal responses, I think sometimes we can fixate so much on verbal responses we forget about the nonverbal. Have a purpose. The nonverbal expressions need to be purposeful. So you really need to be mindful about what kind of facial expressions you're displaying. Client nonverbal expressions are also important for assessing affect, emotion, functioning, congruence, and then depth and meaning of client issues. So if a client changes their facial expressions, they talk about something, or even their tone of voice, you should pay attention to that. Also, if you have taken diagnosis, or if you will be taking diagnosis, certain types of affective displays or emotional response are representative of symptoms often of certain types of mental illness. So patterns are important. So if you see something happen once, it doesn't necessarily mean that it is true. You typically want to see things happen more than once. So every time you talk about your father, you get extremely distressed. And maybe it's a client that's not normally distressed, but whenever they bring up that subject, they become extremely distressed. The nonverbal interaction and verbal interaction are a dance. So I want things, when I'm responding to a client, to match and fit well together. I want to match my client. So if my client is very calm and stoic, I might drop back some of my expressiveness. If my client is very expressive and very loud and talkative, I might bring up my energy level and my expressiveness to meet them. So within the text, they bring up a number of areas to attend to in relation to nonverbal skills. So we have eye contact, body position, and attentive silence. And there will be two more that we're going to attend to. So you need to make sure that you make appropriate levels of eye contact with your client, and you need to monitor what that looks like. So with a client, you want to show and demonstrate that you're listening by making eye contact with them, but you want to monitor the effect. So if you are looking at a client and they're becoming uncomfortable or they appear uncomfortable, you might look away for a bit, or you might not make direct eye contact or be looking at them. There are cultural differences in relation to eye contact, so you need to be attentive to that. Some cultures don't make direct eye contact. I think too with clients that might be anxious, they might be uncomfortable with direct eye contact, but be mindful of when you're looking away, and that might convey discomfort from you to the client, and you want to avoid that. Body position is a posture of involvement, which involves a slight lean forward, so you're not totally leaning into the client, but you really, really, really want to be mindful of leaning back. Leaning back and putting your hands over your chest. This can come off as aloof or distant. I think particularly when people start to get comfortable in the counseling session, in the counseling relationship, they can slide into that posture. So just remain mindful as you start to get more comfortable. Think, am I displaying interest? Am I leaning slightly forward? You really want to avoid, if you lean too far forward, you might put your elbows on your knees, and you want to avoid that as well because that's a very casual stance. So you want to be alert and attentive and open. So open communicates the fact that you really want to cross your arms or across your chest. You can put your hands in your lap, or you can even, cross your legs, but you just want to be mindful that you're not closing your body off from your client, you're not turning away from your client, and you really want to avoid any type of furniture or objects that might obstruct the space between you and your client. Attentive silence. So this is a true nonverbal because you are not verbalizing during it. You need to make room for the client to respond in session. And I think particularly early in training, it can feel extremely uncomfortable for there to even be a few brief seconds of silence. There have been very few circumstances where I've seen someone have too much silence. Often, it feels unbearable to have a few moments of silence, but it can be helpful for the client to collect their thoughts. It can be helpful for you as the counselor to collect your thoughts. You really want to give time, particularly after you say important things, or the client says important things, give them time to kind of reflect on what was said and help to build awareness and strengthen the rest of the counseling session and discussion that you'll have. The counselor should be doing less talking than the client. So this is not public speaking. You're facilitating a process for the client, which means that the client should really be dominating what you're talking about. So you really want to skillfully use your moments to respond. So there should be more time where you're not talking, and then you thoughtfully interject with a well put together response. And then if a client is extremely anxious, or very elevated anger, if there's a strong emotional response from the client, you don't necessarily want to be silent in those moments, unless you have a discussion with the client and they need a moment of silence to calm down. But don't sit there as your client is shaking and looking away and sweating and stop talking in that moment. The vocal tone, so I've talked about this previously in class. You want to be able to communicate that you care and that you're empathetic. It's helpful to be a little bit warm in your communication. Trying to mirror the clients. If you have a very soft-spoken client, you don't necessarily want to be particularly loud with them. If you have a very loud client, if you're very soft-spoken, it might disrupt the balance. Possibly if you want to bring a loud and excited client down, you might want to lower your voice. You really want to use your vocal tone and volume to emphasize or to match the client's expression of emotion. So, sometimes you want to emphasize words where, you were terrified in that moment. That was a very terrifying experience for you. Sometimes you want to communicate calm to the client, and so you might want to, you're very safe right now. It's safe in here. In particular, so you want to be congruent with your facial expressions, but sometimes we are paying so much attention to what the client is saying and what we're saying that we don't pay attention to what the client is doing. And so I mentioned that before, where if a client is talking about something and they're looking away, or if a client is talking about something and they're very traumatic, but they're smiling, that might be an incongruence in their facial expression, their emotion, which you might want to explore further. Gestures. So if you talk with your hands a lot, if you're gesturing, you just want to balance that. So if it's natural and you try to stop doing it, it's just going to make things really unbearable and take you out of the moment. But if you're doing too much of it, it can be very distracting for the client. And then physical distance. So I talked about this a little bit before with your open stance. You have to think about what's comfortable for the client. Does the client need a lot of physical space? Do they need a little physical space? And then just trying to not have obstructions between you and the client. So touching and warmth. Within counseling, shaking hands is typically appropriate to the role in the environment. Particularly if you're working with adults or adolescents, it may not necessarily be the greeting of choice with children. Particularly for beginning counselors, you want to be careful about excessive touch because you want to be able to use your clinical judgment, and until you have a sense of how you are, what your comfort level is with clients, what clients are comfortable with you, you really want to avoid excessive touch. And just to be on the safe side. Once you have better judgment, you can potentially. And I think it's really also a helpful lesson for clients to learn about boundaries. And so I sometimes, even with children, if they want to give a hug, I'll say, oh, I really like when people ask permission before they give a hug. Or you should never be doing physical touch to meet your needs. So typically a counselor is not going to ask a client if they can hug them. So you want it to be appropriate to the situation, and then this next point, not impose a greater level of intimacy than is healthy or appropriate for the client. That's where if you're trying to meet your needs, you really appreciate the relationship with the client, and you want to give them a hug, you shouldn't be asking that question of the client. And touch should not communicate a negative message. Sometimes if you pat someone on the shoulder or kind of put your arm around them, it can be patronizing, and it can say, you need me to console you in this way. You can't console yourself. So you have to be mindful about the message you're sending with touch. So with the first session, you typically want to start it by introducing yourself. You want to go over what we refer to as informed consent. So that includes confidentiality, the limits to confidentiality, talking about the counseling process, and if you have a particular type of theoretical intervention or model that you follow. Ask about the client's experience in counseling and their expectations for counseling, and then ask what brought the client to counseling. And there are some examples in the textbook about how you go about doing that. Especially with the first session, you don't want to spend the whole first session doing paperwork. And if you are going to be doing a large amount of paperwork in the first session, you want to explain that to the client up front, and possibly explain to you that in the future, that's not necessarily going to be reflective of the rest of the counseling process. Then in later sessions, again, you're setting up the dynamic and the expectations for how you're going to spend your time with the client based on how you start the session. I find it helpful because you're trying to engage in a professional relationship with the client. Depending on how they're coming to you, they may be spending a lot of money, or they may be taking somebody else's place to get services. So it's not a social relationship. So it can sometimes set up the wrong dynamic if you start off very casually. It can be nice to start off casually and get someone comfortable in the room with you before you start to engage in counseling, but it's just something to be mindful of. So it can be helpful to review the major points of what you worked on in the prior session. If you're working on a goal, it can be helpful to say, this is where we were last session, where are you now? Is this something that we're still going to continue to work on? Talk about any progress that they've had since the last time you've seen them. Review homework that you gave them. So if you're going to assign homework, you always have to follow up on it, because that communicates to the client that it's a serious and important part of counseling. The worst thing you can do is assign homework and not follow up on it, or assign homework that is not meaningful. And then you can also set the agenda for the counseling session. So this can be helpful with clients if they have a lot that they bring into the counseling session, or they have a lot of anxiety, that you are assuring them that you will get to various things within that session. So maybe they want to talk about 20 things. You have time to talk about 5. So you pick out the 5 that are most important to address, and then you maybe make a list for the next session of what you might want to talk about in the future.